What is a diagnosis? The word diagnosis is a common term in the world of medicine. It is the process of identifying a disease, injury, or condition from its signs and symptoms. To help doctors reach a diagnosis, they get as much information about the patient as possible. There are many different types of tests that the doctor might order. They may need to read the patient's medical history. Blood tests, imaging tests, and possibly biopsies may be necessary. These tests all help doctors make a diagnosis. Some tests, such as biopsies, require surgical interventions. Not all diagnoses require typical medical tests such as imaging, blood tests, etc. Short-sightedness is diagnosed with a basic eye exam, which includes a refraction assessment. Some illnesses and conditions are extremely difficult to diagnose. This is because many signs and symptoms may be non-specific. Redness of the skin, for example, is a sign of many possible disorders. It is not pathognomonic. If a sign or symptom is pathognomonic, it is specifically indicative or characteristic of a particular condition or disease. What's the difference between signs and symptoms? Symptoms are what the patient experiences and describes to the doctors, nurses, and family members, while signs are evident to everybody and not just the patient. When making a diagnosis, the doctors gather information on all the patient's signs and symptoms. Thank you for watching this brief video on diagnosis.